President Obama dispatched his point person on the Affordable Care Act to Detroit today to talk about improvements that she says have been made to the system. 24-hour News 8 political reporter Rick Albin joins us with what the Health and Human Services Secretary had to say and other developments with the Obamacare rollout. Rick?
Well, Kathleen Sebelius said today that the website that has received so much criticism for not functioning is working better than it was. In the same week, when the dismal enrollment numbers were released and the president tried to reset his "if you like your policy, you can keep it" promise, the HHS secretary faced questions about what has been called the president's signature legislation and is also being blamed for his lowest ever approval ratings.
I think the president's concern was if there are people who, because of financial reasons or other reasons, are disadvantaged, the last thing he wants is people to be without coverage. So he's hoping, I know he's going to have a meeting with insurers later today. I've been on the phone with them, and we hope that to the extent possible, insurance companies know who their customers are, know who had those policies at the beginning of October. That's what we're talking about. It's not going back a year or 2 years. It's really someone who was an active customer enrolled in an individual health plan at the beginning of October, and that they will reoffer that policy.
The president said yesterday that people could keep their existing policies for one more year. Problem with that is millions of people have already been canceled, and there is no guarantee that insurance companies will reissue them. One industry group says even if they do, it'll drive up cost even further. In the House today, a Republican bill introduced by Michigan Congressman Fred Upton also dealt with letting people keep their insurance policies. The bill passed, but the president has vowed to veto it, but probably won't have to, since it's unlikely to even get a vote in the Senate. Of that promised veto, Congressman Upton said in a statement, quote, "If the president were sincere in his apology and serious about keeping his promise to the American people, he would work with Congress on bipartisan proposals like the Keep Your Health Plan Act." For now, nobody knows if the plan's implementation is going to get easier or better or worse, or if enough people, most important, enough of the right people, i.e. those who are young and healthy, will get into the system to make it affordable for those who cannot afford health care but need it. Brian?